Further debate? The member for Simcoe Grey.
Thank you, Madam Speaker. When this Liberal government came to office, they promised to balance the budget year after year. In fact, every year. These promises continued year after year all the way to today, 2013. And now with the introduction of this year's budget, we have a document that calls for another $9.8 billion deficit to add to our already astounding $280 billion debt, a debt that is more than doubled since the Liberals have been in power. And again, similar to the promises the Liberals have made in the past, we have a Liberal finance minister proudly touting a plan that makes another vague commitment to balancing the budget by 2017. I mean, give me a break, Madam Speaker. When you look at the budget documents themselves, there's a few graphs missing, a few gaps in the graphs that don't show us how they're getting from, for example, 2015 through to 2017. Where they are reining in the size and cost of government, we have no idea. The sad reality is that there is no financial plan in this province that can be relied upon. There never has been, there has never been, and the proof is in the pudding. Billion-dollar deficits and compounding debts. In fact, this year, Mr. Speaker, congratulations to the Liberal government, we will hit $10 billion in interest payments alone, mostly to foreigners and overseas. People are owed money on their government bonds. And sadly, that now constitutes the third largest ministry after health care and education. Unbelievable. In the last year alone, the Liberals have snuffed off countless blunders of mismanagement and waste, including investigations into Orange, e-health, and the politically motivated cancellation of 2 gas plants. Since January, they've introduced a whole slew of new taxes: the tire tax, the trades tax, more eco-fees, increased WSIB premiums, hydro increases, and the latest proposals that came from Metrolinx and seems to be embraced by the government, a 1% hike in the HST, 5-cent per litre increase in gasoline tax, parking levies, more development charges. I mean, the list goes on and on. And to top it off, the latest budget calls for more spending, which can only mean more taxes. In fact, they spent $1 billion more than planned, Madam Speaker, to buy the NDP support for this Liberal budget. Saying the so-called Premier, and I say so-called Premier because she was never elected Premier, has never been elected Premier, so saying the so-called Premier is out of touch with reality is an understatement. The Liberals' blatant and continued disregard for taxpayers' money is unacceptable and costing us big time. The gas plant scandals alone cost Ontarians at least $585 million and growing to $1 billion. We'll find out what the total cost is probably in late August when the Auditor General comes back with his report. This is money the Liberals diverted from health care and education for purely political reasons to save the Liberal Party seats in the last election. The cost of this scandal is equivalent to 2,925,000 weeks of groceries for the average family at $200 per week. The Orange scandal cost Ontarians at least $700 million. With this scandal, the Auditor General revealed that the Liberal government ignored multiple red flag warnings as early as 2008 over the, quote, deceitful business practices and its plans to use public funds for their for-profit business ventures at Orange. The cost of the Orange scandal is equivalent to tuition for, listen for it, 97,493 university students. The e-health scandal costs have doubled over the last 3 years to over $2 billion, and we don't have electronic health records to show for it, Madam Speaker. This is despite the Auditor General's scathing 2009 report that revealed the government failed to properly oversee the e-health initiative. We still have little to nothing, as I said, to show for this spending, as the e-health projects are either behind schedule, over budget, or non-existent. The cost of this scandal is equivalent to the construction of new hospitals in my riding in both Collingwood and Alliston, and 6 others that could have been built throughout Ontario. That's just the e-health scandal alone. It's a lot of waste that could have been spent in much better ways. Instead of being prudent stewards of the province's finances, Premier Kathleen Wynne's Liberal solution, propped up by NDP leader Andrea Horwath and her gang, continues to be more debt and increased fees and taxes. They might not call it a tax. The Liberals are masters at spinning the truth but a tax is a tax is a tax. The trades tax was implemented by this Liberal government and came into effect on April 8th of this year. It's expected to cost tradespersons millions in what the Liberals term a membership fee to pay for yet another wasteful layer of bureaucracy called the College of Trades. Due to the new fees, local tradespersons and tradespersons all across Ontario and employers are required to pay 6 times more for the same membership that they may now hold. The College of Trades is proposing to raise tradespersons' fees from approximately $20 per year to as high as $200 per year per tradesperson, a 1,000% increase. This, of course, will have a similar negative implication for consumers who will experience the passed-on costs. The new tax is going to drive up costs, feed the underground economy, and discourage jobs in skilled trades. And if it were up to the Ontario PC Party, Tim Hudak and our caucus, the new fees and the College of Trades would be scrapped. Just ask a constituent of mine, Krista Walcroft, owner of Collingwood Toyota, what she thinks about the new tax. She said, and I quote, as an employer of licensed automotive technicians and apprentices, I am not clear on the benefits of this new college. It is becoming more expensive to be a skilled tradesperson, but there's no clear explanation why the increases in fees and no indication of what they will receive in return for paying a lot more financially and frequently, end of quote. Or ask Catherine Van Leeuwen, Vice President of the Barrie Construction Association. She said, quote, we've seen little or no evidence that this trades tax will have any benefit. It will drive up construction costs in Barrie, feed the underground economy, and drive people away from the skilled trades. We joined the campaign to stop the trades because we can't afford to let that happen, end of quote. Or ask James, another constituent of mine from Rosemount, in an email. He put it best, I think, Mr. Speaker. He said, if I graduated from a university and was awarded with a degree, I could carry on and get a job in whatever discipline I wanted relative to the confines of my study. The degree is mine. I never have to pay for renewing it or fees towards some draconian membership unless I choose to be part of an institution, club, or society. So if I'm a truck or car mechanic, I serve 5 years learning the trade. Countless hours in schools and tireless hours of working until I gradually make the trade. Then I sit exams, get awarded my credentials, and I am there. But that trade qualification piece of paper is not yours. It will belong to the College of Trades. Unless you pay an annual fee for that piece of paper, they will deem it to be worthless and can revoke it. In effect, you are not a mechanic at all unless you pay your dues to the College of Trades. This is a complete infringement of the rights and privileges of an individual and can deprive you of having a job. End of the quote. James, and I suggest James is also an excellent writer if he wanted to go into that field. Then there is the tire tax that came into effect on April 1st. Farmers, along with those in the mining and construction industry, have been hard hit by this increase, as it has driven up fees by as much as 2,000%, and it came out of the blue, Mr. Speaker. I was in complete shock when this came in, as there was no consultation at all with farmers. It will not only lead to increases in the cost of food for everyone, but creates an uneven playing field with other provinces and the states that don't have this extra expense. My constituent, Wayne from Singhampton, recently shared his concerns when he said, this drastic rate increase will unfairly penalize farm businesses by costing them thousands of additional dollars in extra fees each year. This decision contributes further to the uneven playing field for Ontario farmers, who already struggle to compete with farmers in other provinces and the U.S. who do not face similar fees. The decision will negatively impact farm businesses and farm supply businesses, further suppressing local rural communities by hurting sales and cash flow to small businesses. End of quote. You would think this issue would be very important to the Premier, who is also the Minister of Agriculture and Food, or should I say the part-time Minister of Agriculture and Food. But apparently not so, Mr. Speaker. The Premier was not only completely unaware of the increase when my colleague, Mr. Bill Walker, the member for Bruce Grey, Owen Sound, raised the issue in this legislature, but she has done nothing to address the mounting concerns from rural constituents. Next, we have WSIB rates that are also increasing, the Workplace Safety and Insurance Board. John from Collingwood wrote, as a small masonry contractor, this amounts to the government sticking its hand in my pocket to the tune of 15% of my income. 15%. All for what? I have carried private insurance for about 40 years and have never used it, but always felt secure that if the day were to come, it would be there for me. From experience as an employer, I've seen that WSIB's main focus is to assign blame and harass injured employees and not provide coverage. Mr. Speaker, on May 1st, hydro rates went up again. Smart meter pricing increased by between 3 and 7%. The list goes on, and while Ontarians are paying a lot more money, they are receiving a lot less service. When you think of how many hospitals could have been built with this money that's been wasted on scandals and waste, or how many services could have been funded, it makes you furious. The Collingwood General and Marine Hospital has a capital expansion application into the government since 2004. The planned expansion, badly needed, includes a new wing for ambulatory care and dialysis. Our dialysis is jammed to the walls, Mr. Speaker. We cannot put any more dialysis stations in the hospital. The ambulatory care and dialysis units would be renovated, which would make more room for an emergency department expansion, which is also badly needed. The hospital is projecting a $500,000 deficit in 2013-14 due to wage increases for unionized staff and 0% funding increase to cover those wage increases from the government. Stevenson Memorial Hospital in Alliston has an application into the Central LHIN for a new emergency department. They are one of only 2 hospitals in our LHIN that don't have a multi-million-dollar capital project approved or in the planning stages. I've also received a call recently from Aurelius Soldier Memorial Hospital, where some of my Collingwood residents go, and I know some of our ALC residents, alternative level of care patients in Collingwood, are basically stuck in Soldiers Memorial Hospital. Although they do get good care there, they would be more appropriately cared for in a nursing home or at home. So from Soldiers Memorial Hospital, the call was about funding cuts that will lead to a closure of 20+ beds and 50+ staff layoffs, which they explained will impact the number of alternative level care patients in my riding who often seek residency in the hospital as they wait for a nursing home bed in a care facility. The Liberals haven't built any nursing home or long-term care beds, Mr. Speaker. We built 20,000 new beds, and I can remember criticism during our time in office, criticism from the Liberal opposition at that time saying we had overbuilt, and we also renovated an additional 16,000 nursing home or long-term care beds. I'm told as of today some 24,000 people, mostly seniors of course, are waiting for a long-term care bed at a home. It's one of the longest waiting lists we've ever had in the province, Mr. Speaker. And about 35% of hospital beds, or up to 35% I know in my riding, of hospital beds in my area, as I said, are full of ALC patients who would get, frankly, they're getting good care, but they would get more appropriate care in a nursing home or long-term care facility. And the waiting list is years. And it's one of the biggest issues I know, Mr. Speaker, you face in your riding, we face right across the province. And yet the government cuts physiotherapy services, expects seniors to stay in their homes and their families to be able to care for them when the lineups for CCAC services are unprecedented also. So totally contrary, if they don't build some more long-term care beds, people will die at home without the appropriate care, Mr. Speaker, and that's not the way we should be heading in a prosperous place like Ontario, where we spend $127 billion a year, up $56 billion since 10 years ago when this government came to office. They've got enough money, Mr. Speaker. They just have to set their priorities over there. I recently heard, as we all are, from countless constituents concerned about the physiotherapy cuts, that according to the Designated Physiotherapy Clinics Association, the cuts are estimated at about $44 million reduction in funding. Again, without consultation with seniors, without consultation with a number of the associations that provide physiotherapy services or represent physiotherapists. And the fact of the matter is, Mr. Speaker, this is a drastic cut in services, and it doesn't make a lot of sense. Again, it goes contrary to keep people in their homes, and that may include the long-term care home or the retirement home that they're in, or their home that they lived in prior to perhaps going to a retirement home or long-term care home. The association indicates that the cuts will reduce services for seniors in long-term care homes alone by 47%, and the number of physiotherapy visits for seniors in retirement homes by 94%. They also note that most seniors will no longer qualify for treatment in their homes, as the new guidelines will force seniors to attend external community clinics. These cuts are shocking, and I'm concerned that this will lead to more falls, more fractures, more respiratory conditions causing hospitalizations, and additional costs to the healthcare system as a whole. The Liberals are moving physiotherapy service from a low-cost provider in designated physiotherapy clinics to high-cost providers in LHINs and community care access centres. This creates an unnecessary layer of bureaucracy that patients will have to go through to receive the same care from the same provider, and will increase the cost per visit. It's estimated from $12.20 per visit to $120 when that care is provided through a community care access centre rather than how it's provided now. And remember, it's well known that community care access centres spend about 35% of the dollars given to them for health care on administration and overhead. So, Mr. Speaker, I was at Riverwood Retirement Home in Alliston in my riding last Friday to talk about these issues with residents and local physiotherapists, and the residents were irritated that the changes were made by the Liberals without any stakeholder consultation, and that they're still going ahead despite the vast opposition we've seen across the province. According to my local physiotherapists and those that visited Queen's Park today, and we had several hundred visit today, and several of us did petitions today on behalf of the physiotherapists and their patients. According to local physiotherapists, these changes will move treatment from a preventive model that stops falls and keeps people active to a reactive model that treats people after an injury has occurred. Let me read one letter I received from a local physiotherapist, one from my riding. He said, "As a healthcare professional working with seniors over the past 5 years, I have a few issues with the changes. His first concern, the proposed 5 treatments, remember they're going from 100 to 150 treatments per year down to 5 to 11 treatments per year per senior. The proposed 5 treatments is not an effective treatment model with this type of population. No one will recover in 5 treatments following a hip fracture or replacement. Even a 20-year-old cannot recover this quickly. The older we get, the longer we take to heal. The stamina of an elderly individual is also reduced, and implementing an hour of therapy each session is not practical. Seniors need shorter, more frequent doses to get better, not 5 power-hour treatments." Concern number 2 that this physiotherapist expressed. He says, "These proposed cuts are based on assumptions and lack of proper research. If we need to reduce spending, we should have a discussion with all the stakeholders involved, not a single doctor who made multiple claims without proper research. Our current Liberal government seems to make huge decisions with very little information." Third concern expressed, our seniors are also unaware of the situation and how it will affect them coming August 1st. The initial announcement was framed as an increase in spending. Why are the Liberals misleading our seniors? Number 4, the cuts will be more severe for retirement homes, and this population stands to gain.
I would ask the member to caution him on his language to ensure that it's parliamentary.
Well, thank you, Mr. Speaker. I'll be sure to get back to my constituent and tell him he's restricted from expressing himself because he has to stick to parliamentary language so I can read his letters out in this House, but I do appreciate your ruling, and I believe it is correct. The cuts, I'll just wind up, Mr. Speaker. It was a very interesting meeting. Again, the government is saying that they're expanding services. They're not expanding services. I think, some of these people have a hard time getting from their room down to the dining room for a meal, and now they're expected to go, in my case, several tens of miles outside of Alliston, either Newmarket or Barrie, to a designated clinic. I don't know who's going to drive them. Who's going to pay for the taxi? You should have been in the room. There were like 50 seniors that were in the common room at Riverwood Retirement Home last Friday, and they were stunned. And they got the message because CTV from Barrie came, interviewed a number of them, and they talked about how important these services were and how angry they were at this Liberal government, Mr. Speaker. Thank you.